Hello, namaskar, and very good evening. I hope I'm audible and visible and सब कुछ ठीक ठाक चल रहा है. I hope everybody is able to see and RDC saying good evening everyone. This session is for FMG, beta anybody can attend. कर तो हम preventive medicine रहे हैं. But of course for FMG I will be doing a separate one. And this is primarily for the NEET exam, which of course has been postponed. So बस यही है. So I hope everyone is able to hear me as well. Is the audio okay? You can just give a thumbs up. So let us take on the session. चलो जी, सब ठीक ठाक है. Everybody is all okay. So beta, what I have done is I wanted to do the session today, and we wanted to complete the whole community medicine का जो भी MCQs पूछे जाते हैं. I wanted to just take care of them. But exam postpone हुआ है. So with the exam I think, and there have been changes as well. Second edition One Touch. But a second edition One Touch is about to be released very soon, and I've already shared the updates with them, and वही updates ही आगे चलने वाले हैं. तो बस you just keep a watch on it. That's the only thing I can say. So beta, what I wanted to do was to complete the entire thing, but of course that has not been possible because exam postponed हुआ है. So what I thought was, let us do this in sessions, different sessions में. I will be available on most of the Wednesdays, and I will try to come online and discuss with you all the important points so that आपका community medicine का syllabus एक organized way में complete हो जाए. We'll be splitting them into sections. So beta, today what I'm trying to do is mother-child health. We will discuss a few points about demography, and we will discuss a few points about contraception, family planning, and vaccines. These are the four important topics जो आज हम touch करने वाले हैं, and we are going to discuss them, see what are the important areas for different MCQs, and that's how we are going to go. So basically मैं आपको ऐसा MCQ दिखाऊंगा. What you have to do is you have to identify the correct answer, and please be interactive and put it in the chat box. Otherwise, how will I come to know that what are you guys thinking, right? So you can just see the MCQs for a few seconds and 30-40 seconds, and then we can go ahead and discuss the question and the topic. These topics which I have selected, these have been previous year topics and some of the recent updates. So बेटा, आज के लिए हमारे पास 4 topics रहेंगे: मदर चाइल्ड हेल्थ, डेमोग्राफी, फैमिली प्लानिंग, वैक्सीन्स. फॉर द नेक्स्ट सेशन, जो नेक्स्ट सेशन कर रहे हैं हम, उसके लिए वी विल टेक ऑन द कम्युनिकेबल डिजीजेस, नेशनल हेल्थ प्रोग्राम्स, नॉन कम्युनिकेबल डिजीजेस ऑल टुगेदर. So the next session would be on this, and third session is on the all the remaining topics. So beta, ये हमारा रहेगा, and this whole program is for NEET exam. So this is for NEET PG PSM simplified, and NEET PG के लिए primarily we are focusing, and we will try to give along with this. This session will be roughly for around 90 minutes and maybe 2 hours, so 1.5 to 2 hours, and primarily the mode of instruction would be English, and because we have different students from different areas. I hope everybody is okay with English, right? So just see what is the best answer over here. Just see what is the best answer over here, beta. This session is primarily for the NEET exam. Matru Vandana Yojana, which of the following is not correct? It provides incentive to all females for the first born child only. It is under the Mission Shakti by Ministry of Women and Child Development. It is a new replaces the old GSY scheme. Mother can avail cash incentive for the second child only if it is a girl child. So what do you think this is? Beta, all these videos will be available for everyone till the NEET exam. Before NEET exam, जब तक NEET exam है ये videos available होंगी. After the exam, unfortunately, these videos will not be available. So इसको बार बार आप पूछेंगे तब भी यही आंसर रहेगा. तो देखो, some students are saying option A, some are saying option D, and some are saying option D and D and A. Maximum students A के लिए बोल रहे हैं. So देखो बेटा, for this question, unfortunately, most of you are doing the wrong answer. Most of you are giving the wrong answer. Batman पक्का A, गलत हो गया बेटा. That's okay. That's what मेरा responsibility, मेरा काम ही यही है कि मैं यहीं पे तो मेरा काम आता है. So मातृ वंदना योजना बेटा, 2-4 बातें, 2-3 points about this. मातृ वंदना योजना is a scheme which has been launched under the Mission Shakti. It is first point. It is under the Mission Shakti. I would always recommend that if you have listened to my classes, तो अपना अगर आपके पास notes हैं, if you have the notes for the classes, I would highly recommend you to take out your notes and keep them alongside this YouTube session. And उसी में ही on the same notes you can keep on writing or adding stuff. Okay. So that is highly recommended. If you have not attended my classes, I would request you to open any of your notes by whatever faculty, open the same topic and write down the notes. Otherwise, if you have not attended anybody's classes, you have not seen anything, then please take a pen and paper and start writing. So Matru Vandana Yojana, 5 important points for you to remember. Question number 1, it is under the Mission Shakti, which is under the Ministry of Women and Child Development. Question number 2, Matru Vandana Yojana, please note it is incentive based program. It is incentive based program. And this incentive based program, it is not replacing the GSY. It is in addition, it is over and above JSY incentive. So it is above the GSY incentive, Janani Suraksha Yojana, already the female is going to get, and above, more than that, she is again going to get the incentive from the Matru Vandana Yojana. So if you talk a little bit more in detail about the Matru Vandana Yojana, second point, third point, point number 3, you have to remember that this is the logo of the Matru Vandana Yojana, right? It is the logo which is Matru Vandana Yojana. And third point, fourth point, that how much is the incentive which is given. The incentive is given to all females. They will get 5,000 rupees incentive. How much? 5,000 rupees. The first incentive, the first installment is given at the in amount of 3,000 rupees. This is when the female will get her pregnancy registered and at least one ANC is completed. It is done within the first 6 months of pregnancy. So that is the first installment. That is the criteria for first installment. The second installment is 2,000 rupees when the child is born and the childbirth is registered and the child receives important first dose vaccines. Which are the first dose vaccines? BCG, hepatitis B, oral polio vaccine and the pentavalent or the DPT vaccine. So when the child has received these vaccines, then the female can avail the next 2,000. So this is given to all females. All females will get this. Now in case the second child for the female is a girl child, again she will get another incentive of 6,000 rupees. But this 6,000 is not given to all females. It is only given to females who bear the second child as the girl child. So if you understand this, this is what is Matru Vandana Yojana. It provides incentive to all females. Am I correct? For the firstborn child? Yes. It is under the Mission Shakti. Yes. It is new initiative and replaces the old GSY. This is wrong answer. This is false. Mother can avail the cash incentive for the second only if it is a girl child. This is also true answer. So which is the best answer you would like to mark? Option number C is the best correct answer for us to mark in the exam. Let us go to the next MCQ. Free medical care services with standardized and good quality healthcare is provided under the which program? So Vidushi says that what about the word only beta? It is for the firstborn child only. वो तो है ही, that is what it is. It is given to all females only for the firstborn child. All females. Think about this, all females and this all females and only. So all will get only for the firstborn. It's just simple English. Aram se, when you are in ease of mind and peace of mind, listen to this video again. It is available till your NEET exams. So that's how the questions will be framed. Free medical services with standardized and good quality healthcare is under which program? This is under the Matru Surakshit Matritva Abhiyan, Surakshit Matritva Ashwasan, Matru Vandana Yojana, or Swasthya Suraksha Yojana. What do you think is the answer? What do you think is the answer? So this is, I think everybody is answering correctly. It's a super duper easy MCQ. It has been asked so many times in your exam. Correct answer is Surakshit Matritva Ashwasan. Ashwasan, it is a guarantee scheme. It is a guarantee scheme. It is called as the Suman scheme. What is Suman scheme? Surakshit Matritva Ashwasan. So this is also important for your upcoming NEET exam beta. What is Swasthya Suraksha Yojana? Swasthya Suraksha Yojana was started in India in 2017, and this is to establish AIIMS-like institutes in India. It is to establish the AIIMS-like institutes and to provide tertiary level healthcare to community, to promote research, and all the AIIMS-like institutes, they have been established under the Yojana or the scheme called as Swasthya Suraksha Yojana. Matru Vandana Yojana, we just now discussed. Surakshit Matritva Abhiyan, that is PMSMA, that is for ANC screening. It is for ANC screening of the antenatal care female. So this is what is Surakshit Matritva Ashwasan. Just 3 points if you want to remember. This was started in 2019, and it is to provide dignified and quality healthcare to all pregnant females, newborns and mothers up to 6 months of delivery. So lactating females are also included, and there is free best quality health services with zero tolerance to denial. Whatever I have highlighted, these are the only MCQs which have been asked or which can be asked for your exam. Let us go to the next MCQ. Which of the following is incorrect regarding FBNC, facility based newborn care? So what do you think? Which of the following is incorrect regarding facility based newborn care? The newborn care corner is available at all delivery points. Stabilization unit is available at CHC FRUs. NBSU can manage sick and low birth weight babies for short durations, and assisted ventilatory support is available at special newborn care corners. What do you want to say? What is the correct answer over here? I'll take a sip of coffee till that time. So what do you think is the best answer over here? Most of you are going with options D. D, C and D. So many students are answering either C or either D. Okay. So beta, if you talk about FBNC, 3 important points or 4 important points for you to remember. So please note FBNC, wherever you have in your copies, please open the copies and write down this topic. This topic, it is a 3-star topic frequently asked in your exam. Beta, the facility-based newborn care, FBNC, it has 3 components. We have NBCC, NBSU and SNCU. The NBCC, that is the newborn care corner. This newborn care corner, it is available at all delivery points. It is available at all delivery points, and this newborn care corner, this is where do you think this will be? Within the labor room or outside the labor room? This is just a newborn care corner. It is a simple corner. So it has to be within the labor room. It is within the labor room, and it is just basic newborn, immediate newborn care equipments or things, like there should be a bed sheet to cover the child, and there should be a nasogastric tube, and simple basic like immediate newborn care cotton piece, and normal saline should be there, and all these things. Then we have is the newborn stabilization unit. Newborn stabilization unit is where a doctor or a pediatrician is available. Generally, best answer is CHC or FRUs. And this is available just adjacent. It is adjacent to the labor room. It is just adjacent. It is just outside the labor room. It is newborn stabilization unit, generally where the doctor or the pediatrician facility is available. And special newborn care units. Special newborn care units, these are wards, and these have 10 to 12 pediatric beds plus 4 to 6 rooming in beds. What do you mean by rooming in beds? Rooming in beds means the mother bed is also available, because the mother also needs to be with the child, right? Rooming in, that's what it is, that the child should be always with the mother. So 4 to 6 rooming in beds, 10 to 12 beds are there. It is a ward, of course, it has to be away from the labor room. And please note, it is going to take care of all the newborn problems. It is going to manage all the sick newborns. It is going to manage the sick newborns. Okay, so a special point I would like to mention over here, that what is not available in SNCU. What is not available in SNCU, that is pediatric surgeries, and also ventilator is not available in SNCU. It is not ICU. ICU is neonatal ICU, right? NICU, neonatal ICU. That is where the very sick children or ventilatory support is available. But as in SNCUs, these are just like small Government of India based you can say special newborn care units, where all the sick newborns who have hypothermia, cyanosis, or who have very severe jaundice, severe anemia, severe pallor, or any congenital heart disease, any cyanotic heart disease, any problem like this, if the child is having, then they are being upgraded to the SNCUs, special newborn care units. Ventilator support is not available, pediatric surgery is not available. So if you just look at these, this is what you have to remember. This is a flashcard. All these flashcards, beta, all these flashcards, these are all numbered, and these are numbered 2096 flashcard. It is all available on my Instagram profile, and these are just small flashcards which you are which very often come in the exam as recent updates. So all the recent updates are available on the on my Instagram profile, and these are just the recent updates. So FBNC beta, newborn stabilization unit, it is for sick low birth weight babies, and stabilization unit, it is available where the FRU and CHCs are available. It has 4 neonatal beds and 2 beds for rooming in. If we talk about the special newborn care units, it is available in all the district hospital where there are more than 3000 deliveries per year, and there are 12 beds, that is the neonatal beds, plus 4 to 6 additional beds are there for rooming in, for step down or for rooming in, 4 additional beds. So just remember, minimum 12 beds are there. And that is what is the special newborn care units. What is not available, that is ventilatory support. So all options are correct answers, beta. All are correct. Newborn care corner is available at delivery points. Yes, this is true. Stabilization is available at CHC FRU. True. Managed sickborn for short time. This is true. Assisted ventilatory support is available. That is the wrong answer. This is the false answer, and that is what you're going to mark in your exam, right? No, SNCU is not available at sub-centers and at PHCs. NBSUs can be there at PHCs, but not usually at sub-centers. Let us go to the next MCQ. And early screening of disease condition which might affect the fetal outcome can be done at PMSMA clinics. What is PMSMA? Pradhan Mantri, Prime Minister, Surakshit Matritva Abhiyan. It is not Ashwasan. Prime Minister Surakshit Matritva Abhiyan. Which of the following statement is not correct under PMSMA? ANC services provided by a radiologist, physician and OBGY specialist. Special ANC services on 9th of every month to routine ANC checkups. Asha receives 500 rupees for mobilization of high-risk pregnant females. One ultrasound done as a part of the PMSMA package in second trimester. So what do you think is the correct answer? All those who have attended the class, I would highly recommend you to take out this topic. This is a 5-star important topic. It is frequently asked in your exam. Make sure you get this question right. So yeah, most of you are going with option C and B. Okay. B and C. Most of you are going with B and C. Good, good. Well done, guys. Well done. So, very good. I didn't know that you guys were able to crack this question. But yes, many of you are going with option C and option D. Okay. So, ANC services can be provided by radiologist, physician and OBGY specialist. I was thinking that many of you will answer option A. Why would a radiologist provide ANC services? But yes, they can. They are part of the panel and they can provide the services. Radiologist, physician or obs and gynae specialist. That is what I think is the... Okay. Chalo, Nilanjana Rajtur says that I think the right answer is C because the mobilization I think is GSY. That's a clever thought, beta. You are correct. Correct answer is option C. Just I'll open the suspense. Correct answer is option C. But it is, you got the correct answer, bache. But the reasoning that you're sharing is not correct because under PMSMA also, Asha gets incentive for mobilization. That's what was the main purpose of me asking you this question. So let's have a look at the PMSMA from a different perspective. PMSMA, Pradhan Mantri Surakshit Matritva Abhiyan. This Surakshit Matritva Abhiyan, it is to identify the high-risk females who are having some risk for maybe postpartum hemorrhage or something like this. And 9th of every month, there is this, it is dedicated to PMSMA clinics. Okay. So this PMSMA, it is private practitioners, they are also encouraged, but it is also conducted at all the CHCs and FRUs. On 9th of every month, there will be free ANC and it is a dedicated day for the antenatal care females. So in this dedicated day, antenatal care females, the female will be identified for all the pregnancy or related diseases. In case there is no problem, female will get a green sticker, red sticker for high-risk pregnancy, blue for pregnancy-induced hypertension and yellow for any other female, like any female with any other disease, thyroid disease, cardiac disease, renal disease, gastrointestinal disease, RTI, STIs, any problem if the female has. Okay, these stickers can also be asked in your exam. So one thing is you should know that it is 9th of every month. Question number 2 is what are the different color codes for the stickers. Now, as far as the cash incentives in Pradhan Mantri Surakshit Matritva Abhiyan are concerned, these are the cash incentives that you can see on your screen. 100 rupees is given to all the ASHA workers who are handling the high-risk pregnancies. HRP stands for the high-risk pregnancies. So to all the high-risk pregnant females, ASHA is handling them. 100 rupees will be given to the ASHA workers for mobilization of the high-risk pregnancy, not for all pregnant females. In case the female is high-risk pregnancy, then 3 extra antenatal care visits are recommended for the female, and she can avail the 3. So try to understand, this is not the antenatal care 4 visits. You remember 4 ANC visits? Now, 4 ANC visits, that is at the sub-center PHC, CHC, wherever they want, the female can get her regular ANC visits. Now, the PMSMA visits are separate visits. It is to be done on 9th of every month. If on the first time, if the female is diagnosed as high-risk pregnancy, she is recommended to attend 3 more antenatal care visits at the PMSMA clinic only. So, for this, the ASHA worker is given 100 rupees. Now, this 500 rupees is also given again to the ASHA worker once we get a good outcome of the mother and child after 45 days after delivery, if the child is still alive and the mother is still alive. So, 500 rupees is given to the ASHA worker for good outcome. This is, please note, only for the high-risk pregnant females. Now, what about the mother? The mother is also given 100 rupees for meeting the transportation cost for up to 3 PMSMA sessions, but this is irrespective whether the female is high risk pregnancy, yellow sticker, blue sticker, red sticker, green sticker, whatever sticker, 100 rupees is given to the pregnant female also to meet the transportation cost. So this is what is the cash incentive which is given in the PMSMA clinics. Yes, it is on OPD basis. And in the PMSMA clinics, beta, there is one ultrasound done every time in the, not every time, in the second trimester. So one ultrasound is also given as a part of the PMSMA package. This is true answer. Okay, in the second trimester. ANC services are provided by the radiologist, physician, OBGY specialist. This is true. Special ANC services on 9th of every month. This is also true. ASHA receives 500 rupees for mobilization. It was not 500. It was 100 rupees for mobilization of the pregnant female. 500 will be given if there is a good outcome. Okay. So this is what you have to remember. Option number C is the best answer for you to mark because that is the only one which is not correct statement. सूरज कुमार भैरवा, आप तो स्पैम करने पे उतर आए भाई. आई सर अर्थ बैच से हूँ. सो बेटा वॉट एवर टॉपिक इज गोइंग ऑन यू कैन स्टडी दैट. अब कोई राजस्थान CHO का अलग एक क्लास नहीं ना होगा. ऐसे तो राजस्थान का अलग CHO का एग्ज़ाम होगा, बिहार का अलग होता है, तेलंगाना का अपना होता है, महाराष्ट्र हैज़ इट्स ओन. सो आई विल बी लाइक हैंडलिंग एवरी स्टेट वाइज देन. बट येस राजस्थान CHO के लिए आई विल हेल्प यू आउट गाइस एंड कुछ ना कुछ आपको नोट्स दे दूंगा. ऐसे अभी का जो सेशन है बेटा उस पर फोकस करने दो ना. देर आर अदर स्टूडेंट्स ऑल्सो. सो दिस इज फॉर NEET एग्जाम्स. सूरज प्लूटो से. So, no, beta, Batman, that's the name of the batch. That's the name of the batch. It's... yes, everybody can see this lecture. I'm not saying कि आप मत देखो. सब लोग देखो बेटा, मेरे भाई मेरे. Everybody should see this. FMG हो जाए, NEET students, INI-SET, MSc, BSc, whatever you want. YouTube फ्री है बेटा, देखना देख लो, आपकी मर्जी है. कोई अच्छा और कोई ज़िंदगी में अच्छा काम है तो वो कर लो, नहीं है कोई अच्छा काम तो मुझे देख लो. मतलब दैट्स द ओनली थिंग आई कैन से. एनीबडी कैन सी दिस, एनीबडी, देयर इज नो प्रॉब्लम. IIT वाले भी देख लो भाई मेरे को. चलो लेट्स गो टू द नेक्स्ट MCQ. विच ऑफ द फॉलोइंग इज नॉट करेक्ट फॉर होम बेस्ड केयर ऑफ द यंग चाइल्ड. अब क्या बोल लूँ इसमें मैं, राइट? एनीबडी कैन सी. Sir, PMSMA on 9th OPD basis, what if it's a Sunday? Yeah, if it's a Sunday, it has to be on the next working day. So, which of the following is not correct for home-based care of the young child? What do you want to say? Which of the following is not correct for home-based care of the young child? ये सारे जो MCQs है ये freshly prepared है बेटा. These have not been picked up from all guidebooks and इधर उधर Q banks. नहीं. I have made these MCQs. These are my handmade MCQs. Okay. So all these are fresh from bakery. Taja MCQs, new MCQs. So what do you think is the best answer? Which of the following is not correct? So, which of the following is not correct for home-based care of the young child? Done by ASHA workers for all children till 15 months of age. ASHA will do 6 visits and to promote health and nutrition of child. So many of you, I think, are going with option B and C, B and C, B and C, B and C. So very nice, very nice. Very good. I think you have got the hold of it. बेटा, what you already know, ये सब आपको already आता था. This is home-based newborn care. Home-based newborn care. Please note, this is again a 5-star MCQ frequently asked in your exam. Home-based newborn care, HBNC. Under the home-based newborn care, this is newborn care. Newborn care started in 2017. The ASHA will visit in the first 42 days of life. Third day, 7 day, 14, 21, 28 and 42. So you can see over here the ASHA worker, the parent, the husband and the wife and the kid, they all are staying together. She's just coming and checking the child. It is to monitor the vitals of the child, to check the body weight of the child, and to encourage good feeding practices and healthy sanitation, hygiene and all these things. So there are total 6 visits. Please note, in case of home delivery, there will be 7 visits. In case of cesarean section, there will be 5 visits. And this is what it is in the home-based newborn care. I think everybody knew about this. Now, because this was a big success, we also started with the home-based young child program. This is the home-based young child program. In this, the ASHA worker, similarly, on the same basis, the ASHA worker, you can see over here, this is the ASHA worker, the father, the mother and the child, and she has in her hand the child protection card, mother child MCP card. Do you know what is MCP? MCP card stands for the mother and child protection card. It is the mother and child protection card. So this mother and child protection card, it has all the important elements which are to be taken care of the child growth and monitoring, as well as safety and protection of the mother. So you can see over here, this ASHA worker is going to help the mother for nutrition support and all these things. And she will visit 3rd month, 6th month, 9, 12 and 15 months. Please note, there are total 5 visits. There are total 5 visits for the child, and this is what is home-based young child program. So please note that this is what is the home-based young child. It is done by ASHA workers. Yes, this is correct. For all children till 15 months, this is also true. ASHA will do 6 visits. No, this is not true. This is false. ASHA has to do 5 visits. To promote health and nutrition of the child, that is also correct. The best answer you would like to mark is option number C. Let us go to the next MCQ. Under the NRC, which of the following is correct? अच्छा, अब आपको, now you have to identify which of the following is correct, beta. You have to identify which of the following is correct. So what do you think? Which of the following is correct? F75 is a transition phase diet. F100 is a maintenance diet. F100 is low protein but high calorie to the F75. Discharge criteria is if the child is able to finish 90% of the feed. Incentive same है Aman Agarwal. Yes, incentive is same. So most of you are going with option B. I think everybody knows about NRC, Nutritional Rehabilitation Centers. NRC stands for the Nutritional Rehabilitation Centers. I think most of you are going with option B. Option B. Very nice. Udupi and Kanupriya, Seni, Surbi, Bagga. A goes with B. Subkar says D. Suraj Kumar is D. So very nice. Most of you are going with option B. बिल्कुल ठीक है बेटा. Very nice. Most of you are going with option B, which is unfortunately the wrong answer. है ना? ये तो आपको पता होगा. ये गलत आंसर है. Option B is not the correct answer. चलो कुछ और मार्क करो. So now most of you are going with option C. Very nice. Option C. ये भी गलत आंसर है. तो C is also wrong. अब बचा गया. You have to identify the correct answer. So what do you think is the correct answer? इसलिए इस बार मैंने आंसर ही मार्क नहीं किया. बैटमैन बोल दो यार, क्या बोलना चाहते हो. अब तो 2 ही ऑप्शन बची हैं, A एंड D. सो I think 50-50% चल रहा है. It's half are saying A, half are saying D. So A भी गलत आंसर है बेटा. I'm so proud of you guys. So high level question. Where is this high level? This is a very stupid simple MCQ. Correct answer is option D बच्चे. You should be knowing about NRC. Peds वाला NRC पढ़ाता है. Gynae will teach you NRC. Beta Prachi, will this be available after live? It will be live. It will be available for you guys till your NEET exam. So, salient points about NRC. So, salient points about NRC, Nutritional Rehabilitation Centers. We have 3 phases. We have stabilization phase, transition phase, and the rehabilitation phase. Stabilization phase, point number 1, it is for how many days? It is for 1 to 2 days. Transition phase is for 2 to 3 days. And the maintenance phase or the rehabilitation is when the patient is discharged. Okay. So in the early stabilization phase, we give a diet called as the starter diet, that is the F75 diet. This is 75 kilocalories and it also contains 0.9 grams of protein. It is 0.9 grams of protein. In the second phase, that is the transition phase, in this the transition phase, the diet that we give is F100 diet. The diet that we give is F100 diet, and it is going to give us 100 calories per 100 grams, and it also contains 2.9 grams of protein. So the protein in F100, it is much higher. Now when the patient is put in the rehabilitation phase, the child has to be put in the rehabilitation phase when the child is able to complete more than 90% of the feed which is given, and there should be no edema of the child and no other medical issue, serious medical issue to the child. So this is total is the child is in the hospital for roughly around 3 to 5 days. The first 2 days, that is the stabilization phase. Then the next 2-3 days, this is the transition phase, and then the child is discharged. So if you can understand all this, F75 diet is a transition diet. What do you think? It is true or false? Obviously, F75 diet is not a transition diet. It is a stabilization diet. So this is false. F100 is a maintenance diet. There is no diet in the maintenance. F100 is the transition diet or the catch-up diet. F100 is low protein. No, it is high protein. It is high protein and high calorie also compared to the F75. Discharge criteria is the best answer. Discharge criteria is if the child is able to complete 90% of the weight. But sir, discharge criteria is not this. So yeah, this is the discharge criteria, beta. This is the discharge criteria that when the child is having reasonable appetite, there is no medical problem, no edema and no other serious medical issue, and then the child can be discharged from. So this appetite recovered and non-medical problem. So that is what is to promote rapid weight gain and normal feeding, home-based diet, home-based hygienic, healthy, balanced diet. So that is what it is. Okay. Discharge criteria from the NRC. This is about the NRC, Nutritional Rehabilitation Centers. Coming over to the next one. As per ICMR 2020 guidelines, which of the following is required in lesser quantities during pregnancy compared to the normal adult non-pregnant female? What do you think is required in lesser quantities? Anshul says discharge criteria is different. Batao beta, what is the discharge criteria? Can you please type it? So maybe I can help you out in that, or you can send me it in my Telegram group. So you can see this Telegram group link, not the link, like you can just search this word Mukhmohit, Mukhmohit01. So bingo, this is like a good answer. Everybody says option D. सर आयरन वो कम टाइम के लिए देते हैं. So bingo, everybody getting the correct answer. Yes, it is iron. Yes, it is iron. So if you just look at this in the non-pregnant female beta, in a non-pregnant female, you have the female would require how much iron? It is 29 milligrams. In a pregnant state, it is 27, थोड़ा सा कम हो जाता है because the female is not having her periods or menses, and then in lactation it is still lesser because the female is again amenorrhea, but the child is also not there, and therefore iron requirement is pretty less. So you can see about the iron. If you look at the folic acid, it is 220, which is 570, roughly 3 times in pregnancy, and lactation it is also again more, 330, right? So edema should be absent, weight for height less than 3 SD MUSC. Hey Bhagwan, Anshul. Hey Bhagwan, beta, you get confused so easily. You are so simple and sweet students. अंशुल बेटा, ना बच्चे ऐसी गलती नहीं करनी चाहिए. क्या बोल रहे हो? मतलब आप देख तो लो, व्हाट आर यू टाइपिंग? दिस इज द क्राइटेरिया फॉर अ सैम चाइल्ड. इट इज नॉट द डिस्चार्ज फ्रॉम द एनआरसी. यू आर you forgot about this, है ना? You got confused. That's okay बच्चे, that's okay, that's absolutely fine. You are, ये हो जाता है पढ़ते पढ़ते ना, कई दफ़ा उल्टा पुल्टा हो जाता है. That happens. So what is a criteria for a SAM child? It happens बच्चे, it happens with me all the time. मतलब बंदे ने पूछा कुछ और, हम जवाब कुछ और देते हैं, because yeah, it happens. So what is a SAM child? Severe acute malnutrition. Severe acute malnutrition is when the child has weight for height is less than -3 standard deviations. Okay, weight for height, it is not height for age, it is not weight for age. Then severe acute malnutrition is also when the mid upper arm circumference is less than 11.5 centimeters. And third criteria, there should be bilateral pedal edema. Pedal edema. This is the criteria to be called as SAM child. अब करना क्या है? What do you need to do for the SAM child? इस बच्चे को उठा के you have to put this child into NRC. NRC में क्या होगा? We will give the child a stabilization phase, transition phase, maintenance phase. Maintenance phase में we do the छुट्टी of the child. छुट्टी means ऊपर नहीं भेजना, उसको घर भेजना है. छुट्टी of the child, discharge of the child. When are you going to discharge? When the child is able to complete 90% of the allocated feed and there is no edema and there is no serious medical issue. ठीक है? So that is what it is. Okay. So, sir, please list of all which is required less in pregnancy than lactation. Very nice, intelligent doubt. Doubt तो नहीं कहेंगे, ये चीटिंग कहेंगे कि टीचर से पूछ लो कि भाई आप ही बता दो, हमने थोड़ी ना पढ़ना है. तो चलो मैं बता ही देता हूँ, which is required lesser in pregnancy compared to lactation. So please note that in pregnancy बेटा almost everything is less except few things. उल्टा चल लो ना. देखो, अगर आप प्रेगनेंसी में देखो, lactation it is energy demanding. मोटा मोटा you should remember lactation it is more energy. Okay, so everything will be lesser in pregnancy compared to lactation. Lactation is always high energy. If you look at calorie, 600 calorie average आएगा. If you look at carbohydrate, 200 carbohydrate. Okay, if you look at iodine, it is again more. Iodine is also high, calorie is also high, carbohydrate is also high, the calcium it is also high, vitamin A is also high. Now what is less in lactation? This is important. Or what is more in pregnancy? Please note that the iron requirement is higher in pregnancy compared to lactation. And also remember that folic acid is required more in pregnancy compared to the lactation. And also remember that protein requirement in the third trimester, it is highest compared to amount of in lactation, because the pregnant female is not reusing all the protein, it is used for the child. So please note that in pregnancy what is required, otherwise all things are required high in lactation compared to pregnancy. Lactation, it is energy demanding process. Okay, so this is important thing that if you want to remember कि हमें pregnancy में what all things are required more compared to the lactation. That is what I think Prajwal wanted to ask, right? So this is what it is, and this is important for your exam. Let us move ahead, bache. Is this question okay? Is this so? Carbohydrate, which of the following is required in lesser quantities during pregnancy? compared to a non-pregnant normal female. So carbohydrate is more in pregnancy, folic acid is more, energy is more, iron is lesser, because non-pregnant, this is not comparing to the lactating, it is comparing the non-pregnant. So let us move to the next MCQ. Which of the following statement is not correct for ANC screening in GDM? ANC screening for GDM. So what do you think is the best answer? So what do you think is the best answer? So the criteria for GDM is fasting blood glucose more than 126. One-step OGTT with 140 mg/dl is managed as GDM. First GDM screening is done in first antenatal, and trial for medical nutrition is given for 2 weeks to all cases of GDM. So you have to find the wrong one, है ना? You have to find the false answer. Acha, false is D. Because it is considered pre-GDM. One-step OGTT is managed as GDM. It is not. It is pre-GDM. ये pre-GDM कुछ नहीं होता बेटा. So most of you are going with option. I think it's a mixed answers. Most of you are going with option B, C. B is, I think, more prevalent. So what do you think is wrong in this? It is one step or two step? What do you think is the wrong point in this? क्या बोलते हो इसमें गलत बात क्या है? अच्छा 120 mg/dl होना चाहिए. ये 120 का क्राइटेरिया क्यों आया? मुदगिल says D. Very nice. Most of you are going with option D. D तो बेटा इट इज़ ट्रू आंसर. चलो आपका आंसर गलत हुआ, ठीक है. यहाँ तो शांति है. अब डी आंसर मार्क करना बंद करो. चलो ये तो गलत हो गया ना. डी तो गलत. सूरज कुमार अभी भी लगे हुए हो आप डी. नो डी तो गलत हो गया. बैटमैन से इज बी 100%. So most of you are now going with option C or B. चलो 140 में सर पहले से ही ओवर डायबिटीज. ओके, सो प्लीज नोट बेटा, स्टार्ट इंसुलिन इफ शुगर इज मोर देन 200. चक्को. सो प्लीज नोट ऑप्शन बी एंड सी ये भी ट्रू है, ये भी आपके गलत हो गए. चलो मैंने आपको आंसर बता दिया. इट इज ऑप्शन ए. दैट इज द नॉट करेक्ट. यू हैव टू फाइंड द फॉल्स वन. ए. चलो बेटा, व्हाट यू गाइज आर स्वीट स्टूडेंट्स. आप लोग इतना छोटी छोटी बात पे गलती करते हो. छोटी छोटी बात पे देखो, दैट इज वेयर ये फ्रेश बनाए एमसीक्यूज है. दीज आर ऑल ट्रिकी एमसीक्यूज एंड दैट इज व्हाट आर बीइंग आस्क्ड इन योर नीट एग्जाम. एंड यू हैव टू, माय मेन जॉब इज कि आप लोगों को आई हैव टू मेक यू अवेयर कि यस बच्चे, दिस कुड बी एमसीक्यू. जोर का झटका जोर से लगे, है ना. सो देखो, ध्यान से देखो. दिस इज व्हाट इज द जीडीएम स्क्रीनिंग गाइडलाइन. दिस इज डायरेक्ट स्क्रीनशॉट. ये जो है ये डायरेक्ट स्क्रीनशॉट है फ्रॉम द जीडीएम स्क्रीनिंग मॉड्यूल विच इज बीइंग टॉट टू द मेडिकल ऑफिसर्स. सो जैसे ही प्रेग्नेंट फीमेल आती है बेटा कम्युनिटी में, एज द प्रेग्नेंट फीमेल इज देयर, वी डू जीडीएम टेस्टिंग इन द फर्स्ट एंटीनेटल केयर विजिट. प्लीज नोट, आई अंडरस्टैंड, आई नो, मुझे पता है कि विद इन 20 वीक्स जब हो तो ओवर डायबिटीज बोलते हैं, आफ्टर 24 वीक्स हो तो इसको जीडीएम बोलते हैं. बट वी डू, गवर्नमेंट ऑफ इंडिया में वी विल फाइंड आउट जीडीएम, वी विल डू टेस्टिंग फॉर जीडीएम इन द फर्स्ट एएनसी विजिट ओनली. सो फर्स्ट एएनसी विजिट कब होगी? इट कुड बी विद इन 12 वीक्स. सो विद इन 12 वीक्स वी विल डू जीडीएम स्क्रीनिंग. अगर फीमेल का 2 आवर पोस्ट प्रांडियल ग्लूकोज, पोस्ट ग्लूकोज टेस्ट इज मोर देन 140. ये OGTT हम करते कैसे हैं? हाउ डू वी डू OGTT? ओरल ग्लूकोज टॉलरेंस टेस्ट. इट इज़ डन यूजिंग 75 ग्राम्स ऑफ ग्लूकोज एंड ये 75 ग्राम ऑफ ग्लूकोज हमने दे देना है और फीमेल का 2 आवर प्लाज्मा ग्लूकोज लेवल चेक करना है. सो बिकॉज यू आर चेकिंग दिस ओनली आफ्टर 2 आवर्स, once only, and that is the reason this is called as one step testing. क्यों बोलते हैं one step? because आप you are checking this only once And please note that this female has to come in a नॉन फास्टिंग स्टेट. उसको बोलते हैं मैडम आप आराम से अपना खाना खा के आओ. सो इट इज़ नॉट अबाउट के फास्टिंग है या नहीं है. नॉन फास्टिंग स्टेट ऑफ द फीमेल, and in the non-fasting state you will give 75 grams of glucose, and you will do OGTT, oral glucose tolerance test. You will check for the plasma glucose after 2 hours. Because you are checking after 2 hours, this OGTT, it is called as single step, one step OGTT. So if the blood glucose, plasma glucose is more than 140 or less than 140, more than 140, you manage as per GDM. This is not diagnosed as GDM. This could be overt diabetes, this could be early onset GDM, we don't know. So whatever it is, this has to be managed as GDM, right? Now, in case it is negative, like 2 hour plasma glucose that is less than 140, then the female will carry on her pregnancy, and in 24 to 28 weeks, there will be repeat testing. How will we do repeat testing? Repeat testing has to be done again using OGTT, 24 to 28 weeks, 75 grams OGTT glucose, and 2 hour one step testing. Again, if it is less than 140, more than 140, less than 140, it is normal antenatal. If it is more than 140, manage as per GDM guidelines. Simple. Right? So please note, how do you manage as per GDM? We have to give them medical nutrition therapy. Medical nutrition therapy. This medical nutrition therapy has to be given for 2 weeks. After 2 weeks, we will check whether it is 120 or less than 120, and then we will see what to do. So, अब बताओ इसमें क्या doubts हैं आपके? What are your doubts? So, Surbhi says fasting not needed. Correct answer. Overt diabetes is 126. No, beta. Saraswati, that is not about overt diabetes 126. Nothing like that. So, yeah, as per GDM screening guidelines, overt diabetes is fasting more than 126. But we don't ask the female to come as fasting. Nah? It's a very simple point for you to understand. India is already a hungry country, poor country. Nah? How can we ask the female to come in a fasting state? That pregnant female, pregnant female is 2 months, 3 months in pregnancy, and we ask her that, madam, don't eat food for 8 to 10 hours. Already the child is malnourished, mummy is malnourished. Where will the country go? So don't think about fasting. So please note, overt diabetes, it is not about overt diabetes, it is about GDM. At the end of the day, what do you want, beta? Try to understand. If you have attended my classes, I discussed this topic quite in detail. At the end of the day, what do you want? You want a normal plasma glucose in the female, nah? Because the child is growing, the pituitary should be normal, the pancreas should be normal, the organogenesis of the child should be normal. Physiological state, that's what you want now. Overt hai, GDM hai, that is immaterial. If the plasma glucose is high, that is going to cause problem in the child. So that's what it is. That's what we are trying to do. So you just try to leave aside overt hai, GDM hai, because at the end of the day, the management is same. Try to understand. The outcome is same. It is just unnecessary we are complicating. So anyways, gynecologists and OBG, they will teach you what is overt diabetes, what is this diabetes, what is that. In Government of India, at the end of the day, we want to have a euglycemic child. So that is what your doubts are. Uttam, 126 is for pre-existing. Yeah, that's all done. So non-fasting, sir, but insulin resistance तो 24 makes में max होती है, तो first में कैसे करेंगे? That's what I want you to understand, Nilanjana, that a female could even be overt diabetes, na? How will I explain you on this YouTube thing? देखो एक mother है, okay? Look at this. Nilanjana, this is for you. A female is there. Now she is pregnant. She has a baby inside, okay? Now if this baby is getting more glucose from the mother, I don't know what do you call it. You might be calling it, see, I'm not so educated. I am a very simple person. I just understand the concept. Now gynecologists will be teaching you that this is the mother and she is overt diabetes or GDM or insulin resistance or plasma, and because there is more blood vessel blockage, and that's the reason you have insulin resistance, so many things happening. So at the end of the day, if there is more glucose in the child, beta, because there is more glucose in the child, the threshold of the glucose for the child who is newly born is increased. And because there is more glucose, there is more growth hormone which is secreted, pituitary pituitary gland is increased in size. That is why you have that macrosomia stuff now, because there is more glucose. So that threshold is high, and that is the reason that there could be sudden neonatal hypoglycemia and immediate neonatal hypoglycemia, sudden neonatal deaths can happen. So at the end of the day, you want to save the pituitary gland and the organogenesis in early stage. Try to understand, if you screen the female at 24 weeks, will you prevent the child from macrosomia? Answer is no. How can you prevent the child from macrosomia when you are detecting GDM at 24 weeks? Tab tak to damage has already been done. Are you able to get hold of this? Whether it is overt diabetes, this diabetes, that diabetes, MODY, LADA, type 1, type 2, whatever it is, if the blood glucose in the mummy is high, then the child is going to get more blood glucose, and the child pituitary is going to overexert because insulin growth, like growth factors, have to be released. Because the insulin, the pancreas is not able to function. The first gland which is formed in a newborn, that is the pituitary gland. So that is what it is, right? So at the end of the day, you have to save the child, and that is why we do screening in early pregnancy. Okay. So then what is the time period for the first antenatal? It is within 12 weeks. Okay. So the criteria for GDM is fasting. No, that is the only wrong answer. It is not about fasting. And it is not 126. This is why this is false answer. It is, I don't know why you did this such a big blunder. It is a direct question. I would not grade this MCQ. I will not grade this MCQ as a difficult MCQ. This is a direct question, beta. You should have identified that. How can sir say that a GDM screening we do 126? 126 थोड़ी ना किसी ने पढ़ाया होगा आपको. It is 140. And fasting, chalo, that is a clever point I wanted to add. So one step OGTT, this is true. With 140 is managed as GDM. This is true. This is correct answer. First GDM screening is done in the first antenatal care. यही तो मैंने लिखा था. Yes, this is true. Trial for MNT is given for 2 weeks to all GDM cases. This is also true. सर अगर नहीं है आई सर 12 वीक्स पे, देन नहीं आई तो क्या करना है? घर से खींच के थोड़ी ना लाएगा मुदगिल. नहीं आई तो नहीं आई, क्या आधी दुनिया नहीं आती? मैं यहाँ क्लास कर रहा हूँ, आधी दुनिया नहीं आई, तो अब क्या करूँ मैं इसमें? मैं क्या करूँ, कोई नहीं आया क्लास? तो ये तो यही है ना, अब घर से खींच के थोड़ी ना लाएगा कोई. चलो चलें आगे. A female comes to you in 4th month ANC screening. Which of the following is not correct for the nutritional advice to the mother? हाँ, मग्गा बिल्कुल सही बोला मग्गा ने. जब आए तो टेस्ट कर लेना. अब इसमें सरकार क्या करेगी भाई मेरे. A female comes to you in the 4th month of ANC screening. Which of the following is not correct for nutritional advice to the mother? Increase calorie intake to 230 to 280. Iron, at least 45 milligrams iron per day. Increase protein to 9.5 grams per day. Calcium intake to be kept as 1000 milligrams per day. So which of the following you think is the correct? ये अब भी किया आपने यार. अगर अब भी तुम गलत बोलोगे ना तो प्रॉब्लम है. अब भी बताया. Yes, just a few minutes ago we discussed this question. So yeah, that's what. Correct answer, I think. Yeah, it is option B. Yes, thank God you guys are saying correct answers now. So like this is the false answer. Like this is the best for you guys to mark. So let's have a quick review of this topic again. Just now I discussed this topic now. That please note that in pregnancy the female will require 22 grams of extra protein in the 3rd trimester, which is the highest. In the 2nd trimester, the female will require 9.5 grams extra. The iron is 27. It is not 45. Iron is 27. It is not 45. Okay. And the calcium is kept as steady as 1000 milligrams per day. So calcium is steady as 1000 milligrams. That is what I was saying. So increase calorie intake to 230 to 280. Why is this written? It should have been 350. Answer is no. If you look at the calorie requirement in the first trimester, beta, it is 70 to 80 kilocalories extra which is required. In the second trimester, 230, 280, and in the third trimester, 390 to 470 kilocalories extra is required. Calorie intake is same. ये होला बोला I think many teachers, I don't know आपने कहाँ का source use किया है, but yes, grossly speaking, roughly speaking, वैसे generally speaking आप ठीक बोल रहे हैं होला बोला that in the first trimester calorie intake is less, is similar. मतलब 70 कैलोरी क्या होता है? What is 70 calories? What do you mean by 70 calorie? होला बोला लिखो जरा चैट बॉक्स में. व्हाट इज 70? 70 बोलना है आपने किसी को. यू वांट टू से दैट 70 चाहिए. ओके. सो 70 में क्या 70? 1/4 समोसा. अब प्रेग्नेंट फीमेल समोसा क्या कोई ढंग की बात बोलना. होला बोला समोसा मतलब अभी तुम्हें समोसा खाना है, भूख लग गई होगी, शुरू हो गया डिनर टाइम. एक रोटी एक्स्ट्रा पूरे दिन की. 1 रोटी एक्स्ट्रा. 7 अंडे. शुभकार कहाँ से आया भाई मेरा? शुभकार 7 अंडे कौन देता रे? सुवनकार ना बच्चे. 7 अंडे में तो खली खाएगा. खली ये कोई जिम थोड़ी ना जा रही है फीमेल. ए भाई नॉर्मल 1 एग इज 70 कैलोरी. पटियाला पैक बना दिया. 7 अंडे. 7 अंडे बहुत ज़्यादा हो गया. सो प्लीज़ नोट 70 कैलोरी 70 कैलोरी. 70 कैलोरीज लाइक 1 रोटी और 2-3 बिस्किट्स इन फुल डे, है ना. यही है ना पूरे दिन में. तो फर्स्ट ट्राइमेस्टर में सम पीपल गायनेकोलॉजिस्ट और पीडियाट्रिशियन विल जनरली से के ठीक है जी नथिंग एक्स्ट्रा इज रिक्वायर्ड, बट टेक्निकली इफ यू अंडरस्टैंड इट इज 70 to 80 किलो कैलोरीज इन द फर्स्ट ट्राइमेस्टर, 230 to 280 in the second trimester, and 390 to 470 in the third trimester. This is what is extra required. If you see in the average in total pregnancy, they say it is 350, but surprisingly 350 कहीं पे भी काम नहीं आता. So that is what it is. First trimester additional, this is true answer. Increase protein intake 9.5, that is also true. Calcium intake to be kept as steady, that is true. So the best answer, you would like to mark the incorrect answer as 45. अभी किया ना 5 minutes पहले. Let's go to the next MCQ बेटा. Let's just finish off. थोड़े बहुत MCQs बचे हुए हैं. Let's just finish off. What do you think is the best answer? Which of the following is not a part of the first referral unit? Not a part of the first referral unit. This is PYQ. This is copy paste from previous exam. This is पुराना क्वेश्चन है. बताओ जरा इसका. अब ये भी गलत करती है पब्लिक. अच्छा जी, ये तो पुराना क्वेश्चन है यार. ये तो आई टुक इट फ्रॉम योर प्रीवियस MCQ. सर यूजिंग मैरो फ्रॉम 4 years. आपको सुन सुन के बड़े हुए हैं. धन्यवाद मुदगिल. मैं भी ना मुदगिल तुम लोग मुझे सुन सुन के बड़े हुए बेटा. मैं तुम्हें पढ़ा पढ़ा के बड़ा हो गया बूढ़ा हो गया. तुम्हें पढ़ा पढ़ा के बूढ़ा हो गया. या दैट इज सो ट्रू. तुम मुझे पढ़ पढ़ के बड़े हुए, मैं भी पढ़ पढ़ के बड़ा हुआ, और मैं पढ़ा पढ़ा के बड़ा हो गया. So yeah, now you are all on the same line. Genetic counseling and screening facility is not available in FRU. So beta FRU, that is first referral unit. First referral unit. What is FRU? First referral unit में क्या क्या होता है? First referral unit is upgraded CHC. These are usually upgraded CHC. In the first upgraded CHC beta, the bed strength is 16 to 30 beds minimum. There should be minimum. There should be functional OT, which is obviously there. Labor room, newborn care, laboratory. This is the most important and the additional feature, that is 24/7 blood storage facility should be there. It is not about the blood bank. It is just the blood storage facility should be there. 24 hours water supply, waste disposal, ambulance, that is obviously there in CHCs. So the only thing which people can test you, that is the only thing which you should be knowing, that there should be in a CHC, there is a blood storage facility that is called as FRU. So in FRU, it is functional OT, everything is true. Genetic counseling and screening facility is not a mandatory part of the FRU, which is the correct answer. Let us go to next MCQ, easy MCQ. अब ये मत गलत करना यार. अगर ये गलत करे ना मेरे दुख होगा, because anemia मुक्त भारत. If you don't know, then you're not eligible to sit for the exam. If you don't know anemia मुक्त भारत. महेश नगर NNL में ऑफलाइन पढ़ा था सर जब आप आए थे. वेरी नाइस, थैंक यू. काफ़ी स्टूडेंट्स NNL वाले बैठे हैं. So anyways, you guys are addicted to YouTube or what? So this session is for NEET exam, but yes, again, welcome. Everybody is welcome. Special newborn care is in district hospital. Yes, beta, it is in district hospitals. इसका आंसर दो, क्या बोलते हो? Which of the following is not correct? Okay, which of the following is not correct? आपको गलत वाला बताना है for IFS supplementation. 20 milligram iron for under 5 years. 400 folic acid for 5 to 9 years. Pregnant female will get IFA tablet from start of pregnancy. Deworming is done to combat helminthic escheriasis. Folic acid is done for pregnant females from 4th month to prevent neural tube defect. गलत वाला ढूंढना है, गलत, रॉन्ग आंसर. ओके, कंफ्यूज नहीं होना, रॉन्ग आंसर ढूंढो. चलो जी, सारी पब्लिक सी बोल रही है, सारी पब्लिक सी बोल रही है, और मुझे गर्व के साथ कहना पड़ता है. वेरी नाइस, वेरी नाइस, वेरी नाइस. बैटमैन बताओ भाई क्या आंसर है? कहाँ गया बैटमैन? तो आया ही नहीं यार, बैटमैन चला गया. बैटमैन आंसर बोलो. वेरी नाइस. 3 गलत है. यस मुदगिल, 3 गलत है. सूरज सेज सी, सूरज सेज सी, 3 and 4. Okay. So most of you are going with option C. I'm very proud of you all. Please note it is option 3, 4, 5. Correct answer. So yes, this is the wrong answer. These are the wrong answers. Anemia Mukt Bharat beta. This is a table which is a 100-star MCQ. 100-star MCQ frequently asked in your exam. 100-star MCQ frequently asked in your exam. And this is what it is. Just a moment beta, just 1 minute, I'll just catch the charger. Yeah. So this is the table which is a 100-star table. And क्या बोलते हो इसमें? प्लीज नोट 6 to 5 years of age, 20 iron, 100 folic acid. 5 to 10 years, 45 iron, 400 folic acid. Adolescent children beta. With children, all the girls who go to school, who don't go to school, they will get iron folic acid, and the boys only who go to school. Boys who don't go to school, there will be no iron folic acid. Remember this point. So all the adolescent children, they will be given 60 milligram iron and 500 micrograms of folic acid, and this is given in a blue color tablet. WRA females, which age group? 20 to 49 year WRA females who are registered with the Mission Parivar Vikas, they will get 60 iron, 500 folic acid, and all the pregnant and lactating females 60 iron, folic acid, and this is given as daily tablets. This is red color tablets. This table, it is 100-star MCQ. Every exam will ask you one question on anemia Mukt Bharat. Every year you get this question. So if you look at this, 20 milligram iron for child under 5 years of age. So under 5 years of age, will we give 20 milligram iron? This is correct answer. This is true answer. 400 folic acid for 5 to 10 years of age. So 5 to 10 years of age, 400 folic acid. This is also correct answer. This is also true answer. Pregnant female will get IFA tablet from start of pregnancy. No, it is not from start of pregnancy. It is from the 4th month onwards. So this is false answer. Annual deworming is done to combat ascariasis. Beta, ascariasis is not related to anemia. It is the hookworm infections which are related to anemia. This is also false answer. Folic acid is given from 4th month to prevent neural tube. What nonsense is this? How can you give folic acid from 4th month to prevent neural tube defects? Neural tube defect will wait for 4 months that government will come, anemia Mukt Bharat will come, and I will not happen. Neural tube defect happens early in the stage. So this is very wrong. This is also false answer. So what do you think is the best answer? 3, 4, 5 all are false. Option C is the correct answer to be marked. Chalo, let us go to the next MCQ. Which of the following is a criteria for severe? Low beta. I think some student had confusion on this. Sir, why last two category got red and not of different any reason or just random? Just random. Just remember the colors. So this is, I think that student also got confused. What is the criteria for severe acute malnutrition? What is the criteria? This thing, pediatrics would love to answer it, but you should also know it. Sir, if annual deworming done to prevent hookworm hota ho sahi hota hai ya biannual hota ho sahi kare? Biannual. Please note, annual deworming is done biannual. It is not annual. So what is severe acute malnutrition? Severe acute malnutrition, you have 3 criteria: weight for height, weight for age, and height for age. Right? These are the 3 things. So for acute malnutrition, what is the criteria? Acute malnutrition, beta, please write in the chat box. What do you think is the criteria for acute malnutrition? For acute malnutrition, the criteria is, it is weight for height. And for chronic malnutrition, it is height for age. For combined malnutrition, it is weight for age, or acute on chronic malnutrition. Very nice, very nice. So everybody should know this. There's simple basic points. So whenever we say severe acute malnutrition, in severe acute malnutrition, please note, less than -3 standard deviation is weight for height. Mid upper arm circumference is less than 11.5, and there is bilateral pedal edema. These are the criteria for severe acute malnutrition. This growth chart you must have seen so many times, and in this growth chart, the upper point, there is a controversial answer. Some people will say 80%, some will say whatever. Please note this junction, it corresponds to 97.5 percentile of the population, and this is -2 SD, -3 SD. So that is what it is. This is what is the growth chart. You have the blue color growth chart for the boys, and a pink color growth chart is for girls. Pink color growth chart is for girls, and the blue color growth chart is for boys. Okay. So I think it's a very simple MCQ. Which of the following is a criteria? Weight for height less than -3. We have discussed this so many times. Weight for height less than -3, that is the criteria for severe acute malnutrition. Which of the following are under Mission Shakti? What do you want to say? Next MCQ. Which of the following are under Mission Shakti? What do you want to say? Any idea? Mission Shakti. We already did this. 1 and 2. Suraj says A. 1 and 2. C. Tukka. 1, 3 and 4. Sayyid Tukka B. 1 and 3. Mostly students are going with maybe, I don't know, it's like equal distribution. I can't assess, but yeah, मुझे लग रहा है कि people are going with C and B more. C and B is more. लेकिन एक और दो तो होता है, मुदगिल कह रहे हैं. मुस्कान is from कायाकल्प. ओ तेरी ना बेटा, मुस्कान is not from कायाकल्प अलग है, मुस्कान अलग है. But yeah, it is related to that. It's not from Kayakal. So, beta, Mission Shakti. You already learned this. Abhi to kiya. Mudgil Mission Shakti, sir. Yes, Mission Shakti. Abhi to kiya aapne. I just now told you. Mission Shakti. It is under Ministry of Women and Child Development. We talked about this. The first MCQ. The first MCQ I told you was this. You remember the first MCQ? Matru Vandana Yojana, which is not correct. I told you Mission Shakti, Ministry of Women and Child Development. है ना? So, ये Mission Shakti है बेटा. Now let us come back to this Mission Shakti. Mission Shakti में you just need to know the names. I don't want to bring too much things over here. Just yes. ये simple points है. It's not something which is out of the world. It will be nice if you know this. दो ही बातें हैं, दो MCQs है. Take it easy. So first MCQ is what are Mission Shakti? दो इसके parts हैं बेटा. There are two parts of Mission Shakti. Shakti means to give empowerment, right? So it is for female. It is under Women and Child Development. Obviously they are going to talk about females. So दो parts हैं इसमें. One is called as संबल. संबल means संभाल के. संभाल के means safely. Safety. So it is for safety and security. Example for this would be the Nirbhaya centers we have, Nirbhaya Nari Adalats we have, Nirbhaya Fund we have. That is to provide safety and security to the females in India. Okay. So Beti Bachao, Beti Padhao schemes, women helplines and Nari Adalats and Mahila Thane are there, Mahila police stations are there. That has all had been launched under the Sambal scheme. Now Samarthya is Samarth. Samarth means to provide them empowerment. So the other aspect of the women of the Mission Shakti is to provide them empowerment by Ujjavala. What is Ujjavala? Ujjavala is to prevent and control human trafficking. Matru Vandana, to give the mothers some cash incentive, and not small cash incentive, huge amount of 5,000 rupees, 6,000 rupees. Matru Vandana Yojana. Then is Kret scheme, Swadhar Greh, if you want you can remember, but these are two important schemes which are under the Mission Shakti. So हमेशा याद रखो Ujjwala. Ujjwala is for the LPG. LPG. So that is not correct. LPG is under Ministry of Petroleum. That is to provide LPG, safer fuels. Matru Vandana Yojana, yes, it is under Mission Shakti. Ujjavala, yes, it is under Mission Shakti. Muskan, it is to provide. Muskan, what is Muskan? Muskan scheme, just remember one line. It is to provide child-friendly services in the public hospitals. It is to provide child-friendly services in the public hospitals. That is what is Muskan scheme. So याद रखो तीन ही बातें हैं यार. Ujala is LED, Ujjwala is LPG, Ujjavala, that is to prevent human trafficking. So 1 and 3 is correct. So किसी ने तुक्का मारा, किसी ने लिख के भी बोला कि तुक्का 1 and 3. So Yeah, 1 and 3 is the correct answer. Okay, nothing much, no serious points, just if you know it, very nice if you know it, and then you are updated, you are fully updated. You can say that I can fight community medicine. So, registration within 12 weeks is the prime responsibility of whom? What do you want to say? Registration within 12 weeks is the prime responsibility of whom? क्या बोलते हो? Hmm. Okay. Most of you are going with ASHA workers. So, registration of pregnancy within 12 weeks, beta. Yes, most of you are going with ASHA workers. आशा वर्कर अनमोल क्या है? अब अनमोल यहाँ पे कहाँ से आया? आशा ताईज. So please note beta, registration of pregnancy within 12 weeks is the prime responsibility of within 12 weeks. आंगनवाड़ी वर्कर तो नहीं है, because आंगनवाड़ी it is under ICDS program. It is to provide nutrition to the child and all these things. Asha worker, yes, this could be the correct answer, but ANM is the best answer. ANM beta, it is the most important function of ANM or the MPW female. MPW is also correct answer, like MPW can be male or female also. But ANM is the best answer because ANM, that is the only responsibility given to them, that registration of pregnancy has to be done within 12 weeks. So registration of pregnancy within 12 weeks, that is the prime responsibility of the ANM female. And of course, if ANM is not in the options, then you can go with the ASHA worker also. But ANM is the single best answer. Okay. So let us go to the next MCQ. Proxy indicator of family size in the area is. What do you think for this? Proxy indicator of family size in the area is. Yeah, thank you so much, Ambika Gupta. Yeah. You are creating suspense like KBC. ठीक है, अच्छी बात है ना, सस्पेंस होना चाहिए. These are now easy MCQs. अब हो गया तुम्हारा गंदे वाला पोर्शन डन. Easy MCQs, proxy indicator of family size in the area. What do you want to say? Family size in the area. It is given by total fertility rate. Correct answer. Very nice. Total fertility rate. That is the correct answer. Family size. Please note that there are 4 important indicators. What is GFR? General fertility rate. It is total number of children a female will bear. Highlight this word, total number of children a female will bear. What is total fertility rate? TFR. TFR is again same answer, total number of children a female will bear during reproductive years, assuming the current age specific fertility rates. Remember, TFR is with age specific fertility rates. Next is what is GRR? GRR, gross reproduction rate. Gross reproduction rate. Gross reproduction rate, you have to memorize. This is the total number of daughters. You have to memorize this is the total number of daughters a female will bear, assuming the age specific fertility rates. Assuming the age specific fertility rates. Last is what is NRR? Net reproduction rate. Net reproduction rate. Net reproduction rate is again same answer. It is the total number of daughters a female will bear. It is total number of daughters a newborn girl child will bear or a female girl child will bear during entire life, assuming the age specific fertilities and age specific death rates. So this is, please note, it is important. Please note, it is important to remember that what is GFR, TFR, GRR and NRR. So GFR is total number of children a female will bear during her women of reproductive years during her reproductive years, in her reproductive years. TFR, that is same answer, children in the reproductive years with age specific fertility rates. Then on the other hand, you have GRR. It is not about the children. They will talk to you about the total number of daughters in reproductive years with age specific fertility rates. And last is NRR. NRR will again talk about daughters in reproductive years with age specific fertility rates and age specific death rates. So please note, death is used only in one indicator, that is NRR. Daughters is used in reproduction indicators. Daughters are used in reproduction indicators. So what I want to share with you, what I want to train you is, beta, please note that if the MCQ says total number of children, तो children का क्या मतलब है? What does children mean? Children means the question is asking you about fertility or fertility. Which one is a better indicator, GFR or TFR? It is TFR. So if they talk about total children, what is the best answer? It is TFR. But if the question says total number of daughters, if the question says total number of daughters, then fertility is not in the option. Then only reproduction indicators will work. Right? So please note, children is fertility and daughters is reproduction. So proxy indicator of family size, that is total fertility rate. Next MCQ, the vaccine which can be given to 18-month-old child who is already immunized with BCG, OPV and hepatitis B. So which of the following vaccines you think it can be given? Kostab More, Sir ji, please avoid coffee after 4 p.m. Neend achhi aaye. Hopefully it's not beyond 4 p.m. wherever you are right now. Yes, I should be avoiding coffee after 4 p.m. But क्या करें बेटा? थोड़ा बहुत तो करना पड़ता है ना, कॉफ़ी वॉफ़ी, बिकॉज दैट्स द ओनली थिंग वी हैव. बट एनीवेज, सो बच्चे, थैंक यू सो मच फॉर योर कंसर्न एंड आई विल कीप दिस इन माइंड. आफ्टर 4 PM हम कॉफ़ी नहीं पियेंगे. अभी वैसे मैं जहाँ पे हूँ यहाँ पे सुबह के 7 o'clock हुए हैं. सो या, इट्स अर्ली मॉर्निंग 7 o'clock with me and I started the class at 5:30 AM. So anyways, Sirji, please avoid coffee. Thank you so much. सर कहाँ हो आप? मैं बेटा यहाँ पे हूँ, दुनिया के दूसरे कोने में. घूमते फिरते रहना चाहिए ना. अब तुम्हारा नीट एग्ज़ाम आ गया एंड आई प्लान्ड फॉर दिस लेक्चर. And I took this option of putting it in studio also. So, and इधर से एग्ज़ाम तुम्हारा पोस्टपोन हो गया तो मैं तो बैठा रह गया यहाँ पे. सर जी बता दो प्लीज़ मोटिवेशन. मैं कनाडा में हूँ बच्चे, साइबेरिया में नहीं हूँ. मग्गा साइबेरिया भेज दे तू मेरे को. हाँ, जल्दी जल्दी एग्ज़ाम पास करके घूमने फिरने चलेंगे. राहुल, कनाडा कनाडा. चलो इसका आंसर दो कनाडा वासियों. पंजाबी और कहाँ जाते हैं बेटा? पंजाबी तो पैदा ही कनाडा जाने के लिए हुए हैं. पंजाबी बच्चा जब पैदा होता है ना, वो रोता कम है, वो कनाडा कनाडा ज़्यादा चीखता है. So, the vaccines which can be given to 18-month-old child who is already immunized with BCG, OPV and hepatitis B. What do you think is the best answer? D option कह रहे हो. D is 2, 3 and 4. Okay. So, 18 months old child who is already immunized with these things. Very nice, bache. Please note that this is the national. Very correct. All of you are saying correct that we will give measles. Yes, this can be given. Japanese encephalitis, it can be given, and 18-month-old child. So DPT can also be given. 2, 3, and 4. This is the correct answer. Please note, if we talk about the national immunization schedule, very nice beta, everybody understand this. सौम्या डीपीटी बूस्टर नहीं कहेंगे, इट्स कॉल्ड एज द डीपीटी 1 बिकॉज इसको एक भी डीपीटी नहीं लगी ना. So at birth, what is the vaccine which we are giving? At birth, we are giving BCG, OPV 0 and hepatitis B birth dose. At 6, 10 and 14, OPV 1, 2, 3, Penta 1, 2, 3, Rota 1, 2, 3. Please note, at 6 and 14, we give FIP1 and FIPV2. I would like you to understand that FIPV2, please note the FIPV2, it is not, I'm going very slow, listen to it very carefully, listen to it please. Please note that FIPV2 is not given with pentavalent 2. FIPV2 is given with pentavalent 3. Okay, and PCV2 is always given with FIPV2 and pentavalent 3. It is PCV2, FIPV2 is not given with pentavalent 2. Okay, so that is the things you have to remember. At 9 months of age, measles, rubella first, vitamin A, JE, pneumococcal conjugate vaccine booster dose, and this is a newly added vaccine, that is the FIPV third dose. At 16-24 months, all the second doses, DPT booster, OPV booster, measles booster or the measles second, Japanese encephalitis second, 5-6 years again we give the booster doses. So please note that this is what we are going to give. And what is the max age for giving this? Max age for starting pentavalent, it is given till 1 year. Measles can be given till 5 years beta. DPT, it can be given till 7 years. Japanese encephalitis, it is given till 15 years. What is the JE which we are giving right now? The JE which we are giving is Kolar strain, that is a killed vaccine. Remember, killed vaccine we are using, and it is given in 2 doses at 9 months of age and 16 to 24 months of age. It is given in 2 doses, and JE is till 15 years and TD has no age. But of course, you are not going to give TD in this question because you are already giving DP and T. So pentavalent not given, that's why not booster. Yes, that's correct answer, Somya. That's what I was saying. So the correct answer to this question is 2, 3 and 4. I think everybody got it correct. Very, very nice. Let's go to the next one. Now are the easy MCQs. You won't get depressed in these MCQs. Which of the following is not correct match? What do you think? Which of the following is not correct match? क्या बोलते हो? Yeah, I think there's also easy MCQ. Everybody going with the option D. These are things which are easy MCQs. IPV, it is inactivated polio vaccine. It is a killed vaccine. That is true. Hepatitis B is a recombinant vaccine. This is also true. JE is a killed vaccine. This is also true. Rotavirus is a live vaccine. Rotavirus is a live vaccine. Please note, HIB is a conjugate vaccine. Also meningococcal vaccine, that is a conjugate vaccine, and pneumococcal conjugate vaccines and all these things. So rotavirus is a live vaccine. Rotavirus, the dose is 5 drops or 2.5 ml. It is 5 drops or 2.5 ml, whatever comes best in your exam. 5 drops is direct answer, better answer. Coming to the next MCQ, live vaccines are contraindicated in all of the following except. What do you want to say? What do you want to say? Pregnancy in 3rd trimester, tuberculosis, allergy to the adjuvant, and case of SCID. Live vaccines are contraindicated in all of the following except. Please note, live vaccines are live vaccines. They are contraindicated in any case of immunodeficiency, in any case of immunosuppression. Who are immunosuppressed? If the CD4 count is less than 200 cells, if the CD4 relative count is less than 15%, in case the person is on long-term steroid therapy, or in case the person is HIV symptomatic, so or in case of pregnancy. So this is contraindication, direct contraindication in case of immunosuppression. Okay. SCID is severe combined immunodeficiency disease. Severe combined immunodeficiency, SCID. So pregnancy in third trimester, yes, this is a contraindication. एलर्जी, सो एडजुवेंट क्या होता है? एडजुवेंट इज जस्ट द इम्यूनो बूस्टर. अगर उसको भी एलर्जी हो जाए, सो इट इज एलर्जी टू द कंपोनेंट्स ऑफ वैक्सीन. दिस इज ऑल्सो कॉन्ट्राइंडिकेशन, SCID. सो ट्यूबरकुलोसिस, इट इज नॉट अ कॉन्ट्राइंडिकेशन फॉर लाइव वैक्सीन. ट्यूबरकुलोसिस वी कैन गिव, राइट? Coming to the next one, which of the following is not correct for the match of the site of vaccine? क्या बोलते हो? Which of the following is not correct for the site of vaccine? Which of the following is not correct for the site of vaccine? We just have around 3-4 MCQs more. That's it. 3-4 more MCQs, nothing much. And all these sessions will be on Wednesdays, and this we just call it as Wednesdays with Mukhmohit. Next week हम communicable disease, non-communicable disease and national health programs करेंगे. And let's see you then. Which of the following is not correct? क्या बोलते हो? सब लोग D बोल रहे हैं, तो शायद D होगा, मुझे क्या पता. देखते हैं. FIPV first dose is in the right upper arm. FIPV third dose is in the left upper arm. JE second dose is in the left anterolateral thigh. Hepatitis B is in the right anterolateral thigh. So very nice everybody. Next week अच्छे से पढ़ के आऊँगा. क्या शेड्यूल है नेक्स्ट वीक का? बैटमैन बिल्कुल ठीक है. नेक्स्ट वीक बताया ना, इट इज़ कम्युनिकेबल, नॉन कम्युनिकेबल एंड नेशनल हेल्थ प्रोग्राम्स. So please note, hepatitis B birth dose is given in the left anterolateral thigh. It is not in the right anterolateral thigh. It is in the left anterolateral thigh. Okay, so this is the schedule. ये हमारा चेंज हो गया क्या? No PDF beta. I never give PDF, and these classes will be available only online and live only for few days. अभी देखना है देख लो. I cannot give you PDF. I cannot make this available online for all that life. यही है. आपको कौन सा पूरी ज़िंदगी देखना है PSM को? एग्ज़ाम दो, अपना आगे चलो, और तुमने क्या करना है यार, राइट? चलो, थोड़ा सा बिगड़ गया था, बट एनीवेज प्लीज नोट दैट दिस इज राइट अपर आर्म, लेफ्ट एंटेरोलेटरल थाई, लेफ्ट अपर आर्म एंड ओरल वैक्सीन. प्लीज नोट ओरल वैक्सीन दीज आर रोटा एंड OPV. राइट अपर आर्म में मीजल्स एंड FIPV1, FIPV2. आई वुड लाइक यू टू पॉइंट ओवर हेयर कि ये याद रख लो. दिस इज द चाइल्ड, वेरी इंपॉर्टेंट चाइल्ड इम्यूनाइजेशन किड, एंड FIPV1 and 2 intradermal in the right upper arm, FIPV3 in the left upper arm. राइट लेग पे सिर्फ एक ही वैक्सीन है, दैट इज न्यूमोकोकल कॉन्जुगेट. बाकी सारी इंट्रामस्कुलर वैक्सीन्स आर गिवन इन द लेफ्ट अपर, इन द लेफ्ट एंटेरोलेटरल thigh. So okay, स्क्रीनशॉट ले लो, बिल्कुल ठीक है, स्क्रीनशॉट ले लो, लेके रख लो. मुदगिल, लव यू सर, थैंक यू वेरी मच, आपको भी बहुत सारा प्यार. आई लव यू ऑल. एंड let's go to the next MCQ. Which of the following vaccines are to be placed in ILR? The following vaccines are to be placed in ILR. Oh, sorry. OPV, hepatitis B, FIP, measles and Prenatal. The correct order of placing the vaccines from bottom to top. नीचे से ऊपर चलना है. बताओ कौन कौन सी वैक्सीन सबसे पहले करेंगे. So if you go from bottom to top, which is the vaccine which is to be kept first? What do you think? Just give me a moment, guys. I have to. I'll be back in 1 minute. The following vaccines are to be placed in ILR: OPV, hepatitis B, FIPV, measles and pentavalent. Correct order for placing in the ILR from bottom to top. So very nice. Batman ने तो already लिख दिया ना. Don't hit people in this room because Japanese manners outshine. Absolutely correct, Batman. Very nice. So please note that once you place in the ILR, if let us say this is the ILR, if let us say this is the ILR, okay, ये मान लो हमारा ILR है. तो इस ILR में आइसलाइन रेफ्रिजरेटर, इसमें at the bottom area, this is the coolest area, it is the coolest area, and we keep the heat sensitive vaccine. So which is the heat sensitive vaccine? That is the Prime Minister, that is OPV and measles rubella vaccine. Then at the top area, which is not so cool area, it is less cool, not very very cool, we keep the freeze sensitive vaccine. Freeze sensitive vaccine is hepatitis B, pentavalent and PCV vaccines. Okay, hepatitis B, pentavalent and PCV vaccines, these are kept in the top shelf. The top shelf, the cover, the top shelf, it is always with diluents. Please note, diluents kahan rakhte hain? Diluents are always kept in the top shelf, and then we have is the freeze sensitive vaccine, and the lowest area we have is the heat sensitive vaccine. तो इसको याद करने का हमारे पास एक तरीका होता है, that heat sensitive vaccines from top to bottom don't hit people in this room because Japanese manners outshine. So you can remember this mnemonic, small mnemonic: don't hit people in this room, don't hurt people in this room because Japanese manners outshine. So this is the way we go from top to the bottom. Top to the bottom. D. Diluents, hepatitis B, pentavalent and pneumococcal conjugate vaccine, IPV, tetanus toxoids and tetanus diphtheria, rotavirus, BCG, JE, measles, rubella, and last is oral polio vaccines. So, so live vaccines, yeah, live vaccines is schoolboy loves crime types. So live से ही नहीं चल रहा sir. So please note. अच्छा लाइव सही नहीं चल रहा. आई थॉट यू आर सेइंग लाइव वैक्सीन्स सही नहीं चल रही. ओ भाई साहब क्या कंफ्यूजन है. अच्छा लाइव रिले स्ट्रीम नहीं अच्छा चल रहा मेडिको प्लस का. आई थिंक मोस्ट ऑफ यू आर गेटिंग ऑल ओके बिकॉज मेरे यहाँ तो द स्ट्रीम हेल्थ एंड एवरीथिंग इज परफेक्ट विद मी. यहाँ तो इंटरनेट का प्रॉब्लम शायद नहीं है वेर एवर आई एम. यहाँ मेरी लाइफ सही नहीं चल रही. ओ तेरी मग्गा क्या करता है यार. लाइफ सबकी अच्छी होती है. लाइफ इज़ गुड ऑल ओके. चलो सो आई वॉज थिंकिंग लाइक लाइव वैक्सीन्स का पूछ रहा है वो. सो लाइव वैक्सीन्स बेटा कूल बॉय लव्स क्राइम टाइप्स. ये एक और न्यूमोनिक है. इफ़ यू वांट यू कैन रिमेंबर दीज आर द ऑल द लाइव वैक्सीन्स. सो कूल बॉय लव्स क्राइम टाइप्स राइट. So yes, yellow fever is also live vaccine. अच्छा बॉय का फुल फॉर्म नहीं लिखा. बॉय का फुल फॉर्म होता है बेटा B stands for cool boy, B stands for BCG vaccines, O stands for OPV vaccine, Y is yellow fever vaccine. Cool boy loves crime types. Okay, chickenpox vaccine and rubella, influenza, measles, mumps, JE, and oral typhi 21A. Ripase is killed. Chalo. This is what is the live vaccines and the heat killed vaccine. How can someone be as chill as Soumya? Very nice. Thank you very much. Chalo bhai. So, which of the following is not a part of the national family planning? Those are questions about contraception. I think 3 questions on contraception. विच ऑफ द फॉलोइंग. और तीनों क्वेश्चन अच्छे क्वेश्चन है. मैं पहले ही डिस्क्लेमर दे रहा हूँ. ट्रिकी क्वेश्चंस है, डिफिकल्ट क्वेश्चंस होंगे. रेटिंग 4 out of 5 रेटिंग एंड रिप टीबी बॉय क्राइम. सो विच ऑफ द फॉलोइंग इज नॉट अ पार्ट ऑफ फैमिली प्लानिंग प्रोग्राम. क्या बोलते हो? क्या बोलते हो? Home delivery for emergency contraception at 2 rupees per tablet. 5-year Mirena is now available at PHC and above. Antara Chaya is under Mission Parivar Vikas. And Asha gets 500 for spacing 3 years after birth of the first child. Contraceptive तो free देते ना. 2 रुपये तो ले लेंदे बैटमैन. 2 रुपये में क्या घिसता. एक तो इमरजेंसी, एक तो बिना उसके किया, ऊपर से 2 रुपये भी नहीं देंगे. ये तो गलत बात है. सर कैन यू प्लीज कीप ऑल दीज वीडियो टिल द एग्जाम इज डन. आई विल ट्राई टू. या इमरजेंसी कॉन्ट्रासेप्ट 2 रुपये देने में भी प्रॉब्लम है क्या लोगों को? मैंने कुछ नहीं किया. 2 रुपये. आप तुमने कुछ नहीं किया. बस तू ही है जिसने कुछ नहीं किया. सबसे खप्पी बंदा तुम ही हो पूरे गैंग में. खप्पी गैंग है बैटमैन का. विच ऑफ द फॉलोइंग इज नॉट अ पार्ट ऑफ द नेशनल फैमिली प्लानिंग प्रोग्राम? मोस्ट ऑफ यू आर सेइंग ऑप्शन बी. ऑब्वियसली दैट इज द करेक्ट आंसर बेटा. Home delivery for emergency contraception. What is the emergency contraception that we use? The emergency contraception that we use, that is called as I-pill or the easy pill. I-pill or the easy pill, a few points about emergency contraception, that is the I-pill. It is a 5-star MCQ. Make sure you know this. This is what we are giving is levonorgestrel. It is given at the dose of 1.5 milligrams Please note this is given as single tablet. It is given as single tablet. It should be given within 72 hours of unprotected intercourse. It is given within 72 hours of unprotected intercourse. IPIL levonorgestrel 1.5 milligram tablet. We can also insert IUDs. IUD can be given within 5 days of unprotected intercourse. It is given within 5 days of unprotected intercourse, and it is also pretty effective. These are the only two things which are like approved by Government of India for these for emergency contraception. These are the only two things which are approved by Government of India for emergency contraception. Okay, coming to next one. 5-year Mirena is now available in all PHC and above. No, this is false answer, beta. Mirena is not available. We have only two IUDs, that is copper T380A and copper 375. So this is the only one which is incorrect. Antara and Chaya pills are available under Mission Parivar Vikas. Yes, this is true. And Asha gets 500 for ensuring 3 years after birth. This is also true. Asha gets her money. Yeah, there is Soumya one tablet Uripristal, and this Uripristal, it is given within 5 days, but it is not available in Government of India. In Government of India under Mission Parivar Vikas, we have only one answer, that is LNG levonorgestrel tablets. That is LNG levonorgestrel tablets. So please note, in Government of India we have copper teas. Copper teas. There are two copper teas, that is copper T 380A and a copper 375 multi-load device. These are the only two intrauterine devices. We shouldn't write copper T. These are the only two intrauterine devices which are available in Government of India. Just one moment. So yeah, A means arms, and that is what is copper T 380A. आज तो मतलब there are so many phone calls which are coming, I don't know, and सब लोग because exam delayed हो गया, so many students calling, so many people calling, I don't know why, but that's how it is. So which of the following is not a part of family planning program? Option B is the only one which is false. Asha gets this thing. Let us go to the next MCQ. Which of the following is incorrect statement? क्या बोलते हो? क्या बोलते हो? Next MCQ. Which of the following is incorrect statement? ऐसे सेशंस होने चाहिए, मतलब what do you think? Should I have more of these या once a week is fine? वैसे तो once a week भी ज़्यादा है मेरे लिए, बट ठीक है, अब once a week भी नहीं करेंगे तो क्या करेंगे? You know, I am a very lazy person. मेरे से lazy कोई भी नहीं होता. यस सर, हनी चाहिए, हनी चाहिए. शहद ले आ फिर तुषार जाके. कहाँ से शहद लाएगा? ट्वाइस अ वीक है ना. मैं कहता हूँ बाय एनुअल होना चाहिए. बाय एनुअल इज इनफ. सो विच ऑफ द फॉलोइंग इज इनकरेक्ट स्टेटमेंट? पंजाबी है आप, लेजी और लस्सी पी के और अमृतसरी कुलचे खा के नींद ही करनी है. खाना और पीना और सोना हमारा काम होता है बेटा, पंजाबी बंदे और क्या करते हैं. So which of the following is incorrect? Most of you are saying option number D. Most of you option saying albendazole थोड़ी ना. बेटा ये है तो अल्बेंडाजोल जैसा ही है, कीड़े मारने की दवाई है। ये जो क्वेश्चंस हैं ये कीड़े मारने का ही तो काम है, ये दिमाग के कीड़े मारता है ना। So Mirena is used till 5 years. This is true answer. Mirena is used till 5 years. This is true answer. Copper 375 is used till 5 years. Copper 375, yes, this is also true answer because there are two copper Ts, there are two IUDs. Copper T 380A, which is applicable for 10 years, and copper 375, which is applicable for 5 years. In non-breastfeeding female, OCP can be given 3 weeks after delivery. Yes, this is also true. Yes, this is also true. So, terminal method is barrier method. Barrier लगाने से कोई terminal method permanent थोड़ी ना हो जाएगा. So, this is not a permanent method. कोई चिपक थोड़ी ना जाएगा barrier method. So, please note, condoms or barrier is not a permanent method. It is a temporary method. So permanent methods would be like tubectomy or vasectomy. So obviously it's a funny answer, but option D is the only one which is to be marked. इसमें कोई confusion थोड़ी ना होनी चाहिए. जिसने इस क्वेश्चन को भी गलत किया है वो फिर कहीं जाके मुंह हाथ धो के आए. कोई वो परमानेंट थोड़ी ना चिपक जाएगा. It's not the terminal method. Okay. And all other options are correct answers. Next is the common side effect after 1 to 2 years of DMPA. Common side effect after 1 to 2 years after DMPA uses. Amenorrhea, dysmenorrhea, menorrhagia, metrorrhagia. So, most common side effect. Is option A, C, C. Very nice. I think काफ़ी स्टूडेंट्स को ये आता था. I was thinking कि ये mostly आप लोग गलत करोगे. I was under this impression, but very nice. I'm so proud of you guys कि आपने बड़ा अच्छा आंसर किया. देखो इसका आंसर मेट्रोरेजिया तो नहीं है, ठीक है. मेट्रोरेजिया तो नहीं है. इसका आंसर क्योंकि मेट्रोरेजिया नहीं है तो ऑब्वियसली इसका आंसर मीनोरेजिया भी नहीं होगा, बिकॉज दे बोथ मीन लाइक मोर फ्रीक्वेंसी एंड मोर हैवी ब्लीडिंग, राइट. सो ये दोनों तो नहीं होने वाले. डिसमेनोरिया पेनफुल ब्लीडिंग होता है तो ये भी नहीं होने वाला. तो डीएमपीए का मैक्सिमम साइड इफेक्ट इज ऑब्वियसली, डू यू नो, 70-80% actually will land up into amenorrhea. 70-80% actually will land up into amenorrhea, and amenorrhea is the most frequent long-term side effect. Do you know 80% will land up, 80% of the female will land up into amenorrhea after 2 years or within 2 years. Right? So please note, amenorrhea is the correct answer. 50% users experience it within 1 year. Rarely there will be prolonged or heavy bleeding. It is very rare side effect. Irregular bleeding can happen in 40% of cases, but maximum cases will eventually irregular bleeding hoga, and then eventually the female will land up into amenorrhea. So please note, amenorrhea is the most common side effect, right? And that is what is the most common side effect of DMPA injection use. I hope you all know what is DMPA. It is Antara injection. Antara injection. फटाफट से लिखो. Antara is given how much? It is 150 milligram. What is the duration? It is given every 90 days. It is given every 90 days, 150 milligram. And how is it given? And how is it given? It is given intramuscular. Very nice. It is given intramuscular. Very good. Correct answer. It's not subcutaneous. There is something else. It is called as Depo-Provera, which is 105 milligrams of DMPA, and it is given subcutaneous injection, but it is not available in Government of India. It is Depo-Provera, that is 150 milligrams subcutaneous injection. That is separate. It is not Antra. Antra is DMPA injection 150 milligrams intramuscular given every 90 days. And what is the time span? What is the grace period in which we can give Antra injections? Do you know, before or after the due date? If this is the due date, by when we can give Antra injection? If this is the due date of giving Antra injection, we can give how much before or how much later on? Very nice. It can be given 2 weeks before, 2 weeks before the due date, and 4 weeks after the due date. ए भाई सौम्या, 2 months नहीं है, 3 महीने तो टोटल होता है बेटा. 2 months नहीं है सौम्या. इट्स नॉट 2 months. इट इज 2 weeks बिफोर और 4 weeks आफ्टर. ओके. सो लेप्रेसी के लिए, लेप्रेसी बेटा वी विल डिस्कस नेक्स्ट टाइम. चलो, लेट अस गो टू द नेक्स्ट एमसीक्यू. विच ऑफ द फॉलोइंग ग्रुप कैन रिसीव डीएमपीए विदाउट एनी कॉशन? I think this is the last MCQ. तुसी तो हरियाणवी भी बोल है बेटा. मैं हरियाणा में पैदा हुआ हूँ और मैं रहता भी वैसे हरियाणा में हूँ, और मैं काम हिमाचल में करता हूँ, और घूमने कनेडा आता हूँ, पढ़ाता तुम सबको. सो विच ऑफ द फॉलोइंग ग्रुप कैन रिसीव DMPA विदाउट एनी कॉशन? Which app you are using to screen share? Which app you are using for writing on iPad? बेटा this is भगवान ने दी हुई है ऐप पे ऊपर, मेरे को नहीं कुछ पता. ये हमारे जो टेक्नीशियन बैठे हैं यहाँ पे, he is my helper and वो सारा मैनेज करते हैं. तो हत बुड़बक बिहारी भी सुना दीजिए. काहे बिहारी सुनाएंगे? Which of the following can receive DMPA without any caution? बताओ इसका आंसर. History of severe liver disease, history of DVT, breast cancer patient on treatment, and severe dysmenorrhea. English भी बोलता हूँ मैं. So which of the following group can receive DMPA without any problem? Please note, this is Government of India guideline that DMPA most of you are saying option D. Most of you are saying option D. So people who can receive DMPA without any caution. DMPA is what is Antra. DMPA is what is Antra. So Antra के लिए बेटा, I would like to tell you that Antra, what are the indications? It can be given. It can be given to all these people. It can be given to females who are heavy smokers, 6 weeks postpartum. It can be given to thyroid, fibroids, STD, PID, rifampicin, rifabutin users, severe dysmenorrhea. So Government of India says that the category 1 of people who can use DMPA, it can be given to heavy smokers, breastfeeding females after 6 weeks postpartum, thyroid, severe dysmenorrhea, all these people. So in category 2, if it may be used, it can be used in females who are less than 18, more than 45, which is generally not the scenario. In cases of diabetes or gallbladder disease, we have to use it with a little bit caution. And in category 3 is usually not recommended. So breastfeeding before 6 weeks, severe hypertension, uncontrolled diabetes mellitus, ischemic heart disease, complicated diabetes, severe liver disease, Antra injections or the DMPAs are generally not recommended, and it is absolutely contraindicated in females who are with breast cancer. Okay, so most of the liver problems, diabetes, ischemic heart disease, you can just imagine it's a progesterone. So just remember that because it is progesterone, so any case which is related to more atherosclerosis and kind of more metabolic disease, progesterone is generally not indicated. Metabolic disease like severe hypertension, uncontrolled or complicated type of diabetes, any case of stroke, ischemic heart disease, liver diseases, liver tumors, Antra is usually not recommended. But yes, it can be given in all other cases. It can be used in all other cases. So if you just understand this small point, so which of the following can receive DMPA without any caution. Severe liver disease, it is generally not recommended. History of deep vein thrombosis, it can be given, but generally more atherosclerosis type of thing, so we don't give DVT. Breast cancer to bilkul absolute contraindication, and severe dysmenorrhea, it can be given. So what is the correct answer? You would like to mark option D as the best possible answer. Okay. सर PSM लाइव क्लासेस लिया करो, हमारा दिमाग के पेज खुलते हैं, पेज खुलते हैं। अच्छा अच्छा अच्छा, वेरी नाइस। तो दिमाग के पेज खुलने चाहिए, अदरवाइज लोग तो यही बोलते हैं ना दैट PSM इज बोरिंग एंड क्रैम कर लो, रट्टा मार लो। सो मोस्ट ऑफ द पीपल आर डूइंग लाइक दिस के क्रैम कर लो एंड ऑल दीज थिंग्स। सो माई फंडा इज नॉट अबाउट क्रैमिंग, आई डोंट लाइक क्रैमिंग एंड मुझे तो जब तक चीज़ भेजे में समझ ना आए, जब तक वो दिखने ना लग जाए, तब तक आई कांट अंडरस्टैंड। एंड इसके साथ ही आप सबका बहुत बहुत धन्यवाद। ऑल दो स्टूडेंट्स हु आर मैरो यूजर्स, यू आर very much recommended that you use the Marolinks group. You might be using them, and I am also found on Instagram. This is my ID. And ये Telegram का है बेटा for all the MCQ discussions. MCQ discussions usually happen on my Telegram ID. We conduct daily MCQs, and I try to take care of all the answers for the MCQs. And for all the updates, you are very welcome to follow us on Instagram. You're welcome to follow us on Instagram. If you want to download any guidelines, I have these websites. These are the website links, and psmsimplified.com and mukhmohit.com, and there are updates and guidelines. You can just download the files from there. और आई होप कि आपका जो अगला एग्ज़ाम का डेट जल्दी अनाउंस हो, ये कन्फ्यूजन ख़त्म हो। एंड दिस इज़ द टाइम बेटा, दिस इज़ एग्जैक्टली द टाइम वेयर यू हैव टू बी वेरी कॉशियस एंड वेरी फोकस्ड। Many students normally message me कि सर when the date exam postpone का डेट जब आया ना कि एग्ज़ाम postpone हो गया and I lost focus। ये पॉइंट बेटा आपका वीकेस्ट पॉइंट है। इस पॉइंट पे मैं आपको वैसे ही कॉशन कर रहा हूँ, ये पॉइंट वीकेस्ट पॉइंट है। इस पॉइंट पे मैक्सिमम बच्चे जो हैं वो गलती करते हैं कि वो अपना फोकस लूज़ कर देते हैं, और वो एक दफ़ा फोकस लूज़ करते हैं, वंस दे लूज़ द फोकस देन इट इज़ वेरी डिफ़िकल्ट टू कम बैक, राइट। सो कहते हैं कि विकल्प बहुत मिलेंगे मार्ग से भटकने के लिए। एट दिस जंक्शन बहुत सारे आपको तरीके मिलेंगे मार्ग से भटकने के लिए, संकल्प एक ही काफ़ी है अपनी मंजिल को पाने के लिए। सो यू जस्ट हैव टू बी वेरी श्योर दैट यू आर हाईली फोकस्ड and you do not have any kind of deviations for yourself, no distractions. At this time there's a lot of noise coming from people that ये कर लो, वो कर लो, and ये भी देख लो, पोस्टपोन हो गया, कोई बात नहीं, चलो अब हम ये पढ़ लेते हैं। ऐसा मत करना। जिस टीचर को आपने फॉलो किया है ना, उस टीचर को फॉलो करो and try to revise the notes, or I won't recommend you to revise the notes. You do more MCQs at this time. Give grand test, give mock test. Last का 1 month is always for mock test and grand test. No taking in new things. And ये जो questions है, मैं यहाँ पे आपने देखा होगा, I did not want to give you new information. I just wanted to refine your information in a different manner so that you are able to attempt the high level MCQs. That is the only thing. I did not, my main purpose, I always thoughtfully made MCQs कि मैं आपको rare चीज़ें या हाई फाई चीज़ें ना पढ़ाऊँ, वही चीज़ अलग नज़रिए में पढ़ा दूँ। ये मैं करना चाह रहा था, दैट वही चीज़ हो बट इन अ डिफरेंट व्यू पॉइंट, सो दैट आपका दिमाग थोड़ा खुल के देखने की वो क्षमता रखे, that how to manage the MCQs in the exam. Because I personally believe, and you आप सबको भी, you all must be knowing about it, that in your NEET exam, it's not the previous year MCQ थोड़ी ना repeat होंगे, right? They won't be like the same MCQs will not be repeated. Same MCQs will not be repeated. It will be different MCQs, it will be different topics, it will be different, you can say, things which are there. It will be different things on the same different type of topic, same रहेगा, but MCQs आपके वहाँ पे change होते रहेंगे, right? So I just want you to understand that this is the weak, you should be knowing this, that this is the weakest point you have. And इस weakest point पे, because the exam date postpone हो गया, you have to stay highly focused and undistracted. वो अर्जुन की वो चिड़िया की आंख की तरह देखना है कि हमें सिर्फ वो आंख ही दिखे कि यार whenever the exam is, I will attempt this and make use of this. Try to give more subject wise test, whatever subject you were lacking. अगर डर लगता है ना, if you are scared of biochemistry, if you are scared of anatomy, if you are scared of microbiology, if you are scared of pharmacology, कुछ नहीं करना, 5-10 दिन लगाओ कि यार thankfully exam postpone हुआ. 5 days I will spend on pharmacology. If you for me, I'm scared of, for example, I'm scared of biochemistry. So I will give 5 days to biochemistry. 5 days में I will do 300 to 400 MCQs. रेट्रो पढ़ेंगे, रेट्रो पढ़ना है. ओके, इट इज़ वेरी डिफिकल्ट कि अब मैं बैठ के कोरी साइकिल, क्रैब साइकिल और सारे इनबॉर्न एरर्स ये सब पढ़ाई करेंगे. रेट्रोग्रेड पढ़ना है. वट एवर सब्जेक्ट इज डिफिकल्ट फॉर यू, वट एवर यूर स्केर्ड ऑफ, जिस चीज़ का डर है उस डर को निकालो. 5 days में यू डू 400 MCQs रेट्रोस्पेक्टिवली and you try to read the explanations and see the topics. Okay, that is very very important. Marrow में different mobile apps में, of course Marrow is giving you the gold standard information. The QBank team makes sure that they give you authentic information with references and in tabular form. वो explanation पढ़ लो बेटा, जिंदगी सफल है अपनी, सफल है जिंदगी आपकी. तो दिस आई एम टेलिंग यू फॉर ऑल द सब्जेक्ट्स. बेटा ये जो डर है ना, डर, दिस फियर, यू हैव टू ओवरकम दिस फियर से बाहर निकलना है यार. क्या डर होता है, डर क्या होता है, मतलब डर तो तब तक डर है जब तक डर आपको डरा रहा है. यू हैव टू ओवरकम दिस फियर, एंड इस फियर को ओवरकम करने के लिए यू हैव टू डू समथिंग इन द सेंस के क्यू बैंक उठाओ और उसको रेट्रोस्पेक्टिवली पढ़ो. और इतना अंदर मतलब जिगरा होना चाहिए. यू शुड हैव द विल पावर दैट डर को हम ओवरकम करेंगे ही करेंगे. वी आर नॉट गोइंग टू स्टे विद द डर. ये डर को निकाल दो. ये जो अभी का टाइम है ना, बिकॉज वंस यू आर नियर टू द एग्जाम देन यू विल नॉट बी एबल टू ओवरकम द फियरफुल सब्जेक्ट्स. अभी ये जो टाइम है ना, इसको यूज़ करो एंड डोंट गेट डिस्ट्रैक्टेड. फुल फोकस के साथ चलना है और पेरेंट्स का आशीर्वाद लो. जिसको भी आप, यू बिलीव इन हुएवर, लाइक गॉड को बिलीव करते हो, अल्लाह को बिलीव करते हो, भगवान राम को होता है, गुरु ग्रंथ साहब है, कुरान शरीफ है, गीता है, जो भी चीज़ है उसको हाजिर नाजर मान के यू जस्ट गो हेड एंड ट्राई टू प्रे टू गॉड के यू शुड नॉट गेट डिस्ट्रैक्टेड इन दीज days. So that was another my main focus के यहाँ पे I wanted to come live to you and talk to you कि भटकना नहीं है इस टाइम पे, डिस्ट्रैक्शन नहीं होना चाहिए. स्टे फोकस, गिव मोर MCQs. फियर फ्रॉम रॉन्ग आंसर्स, बेटा इस डर को ना निकाल दो. फियर क्या है, डर तब तक है जब तक डर आपको डरा रहा है. इस डर को निकाल दो यार. ये 2 महीने भगवान ने आपके लिए एग्जाम पोस्टपोन किया है. डर तब तक डर है जब तक आप डर रहे हो उससे. एक दफ़ा उसको करना शुरू किया ना, डर की ऐसी तैसी हो जानी. एंड यू हैव टू डू दैट. You have to do that. There is no other option for you. Right? So, should I include new MCQs? Definitely, Batman, you should include new MCQs because that will open you to a different world of what you had been watching. पुराना MCQ नहीं ना पूछा जाता. Right? चलो. Will there be session like this for FMG? I will try to conduct more sessions, but next week, next week हम session करेंगे बच्चे. I will come next week and hopefully my team will allow me to come next week. I'm very thankful to our team and सब लोग काफ़ी मेहनत करते हैं for these live sessions बेटा. It's not only me and you. तो आज हमने टुडे वी हैव डिस्कस दिस एंड नेक्स्ट सेशन वी विल कंडक्ट. आपको डेट मैं अभी अनाउंस अभी नहीं करूँगा. मे बी इट शुड बी ऑन द नेक्स्ट वेडनेसडे. आई शुड बी अवेलेबल ऑन नेक्स्ट वेडनेसडे फॉर दिस सेशन. but date will be announced on the Telegram and on Instagram very very soon. And next Wednesday I will try to see you on communicable disease, national health programs, all the non-communicable disease as well. MCQ कहाँ से करना है बेटा? MCQ जितो मर्जी कर लो, from wherever you want, and do as much as you can. I'm a firm believer. आपके पास मोबाइल एप्लीकेशन M है, P है, D है, S है, A है, whatever मोबाइल एप्लीकेशन you have, भगवान से ना मतलब you should be thankful to God कि आपके पास इतना कुछ है. टेलीग्राम में तो सब कुछ पड़ा है. So with whatever you have, wherever you are, how much better you can do, you should do. Don't think कि मैं वही करेंगे. So don't think कि वो वाली एप्लीकेशन ही करनी है. With whatever you have, best you can do. So बजाय कि instead of reading 5 books or 5 Q banks and 5 different sources one time, you should study one source 5 times. Okay? So rather than studying 5 different sources, take one source और उसी एक सोर्स को 5 दफ़ा कर लो, वो आपके लिए ज़्यादा अच्छा रहेगा. चलो, I thank you all students for giving me opportunity and time to interact with you all guys, and thank you so much for being a part of the session today. And I pray to God that you all get strength and commitment and dedication to do what you are supposed to do today. बस मेरी यही दुआ है ऊपर वाले से कि भगवान आपको इतनी क्षमता बख्शे कि आपको जो कार्य करना चाहिए आप वो उस समय पे अपनी पूरी शिद्दत के साथ, अपनी पूरी मेहनत और डेडिकेशन के साथ, लगन के साथ आप वो कार्य को संपूर्ण करें. बाकी उसका फल क्या होगा वो ऊपर वाले के हाथ में है बेटा. आप अपना काम कर रहे हो कि नहीं कर रहे, दैट इज़ व्हाट इज़ गोइंग टू डिटर्मिन द रिजल्ट्स. रिजल्ट क्या होगा, अच्छा होगा, नहीं होगा, आई एम नॉट बॉदर्ड. यू शुड नॉट ऑल्सो बी बॉदर्ड. यू आर डूइंग योर वर्क, येस और नो, दैट इज़ व्हाट इज़ इम्पॉर्टेंट. सो यू हैव टू डू इट विद फुल ऑनेस्टी. एंड जो बंदा अभी आपको बोल रहा है ना दैट बेटा कोई बात नहीं, थोड़ा रेस्ट कर ले यार, रात के 9-10 बज गए हैं, काहे को ऐसे सुन रहा है, किसी को बैठा यूट्यूब पे बैठा हुआ है, वो बंदा आपका बड़ा दुश्मन है कि यार रेस्ट वेस्ट क्या होता है यार. 2 महीने पूरा जी जान से काम करेंगे, फोड़ देंगे एग्ज़ाम को. और ये फोड़ देंगे वाला जब तक सनक दिमाग में नहीं आती ना तब तक कुछ होगा भी नहीं. सो यू हैव टू मेक श्योर दैट यू हैव दैट सनक इन योर ब्रेन एंड यू वर्क विद फुल डेडिकेशन. आगे क्या होगा यार वो तो ऊपर वाले के हाथ में है ना, वो हमारे हाथ में नहीं है. सो इसको पूरा अच्छी तरह करो. जो काम करना है तसल्ली से करना है, नहीं तो नहीं करना है. वो स्टाइल से करेंगे जो काम करेंगे, राइट. सो सर लाइव सेव होगा ना? हाँ जी बेटा लाइव सेव होगा. धन्यवाद सर जी, धन्यवाद. थैंक यू वेरी मच. हैव अ गुड नाइट एंड कीप ऑन रिवाइजिंग. ऑल द वेरी बेस्ट. सी यू ऑन द नेक्स्ट वेडनेसडे. ओके, मे बी इट्स 11th of June. I'll keep you all posted. एंड तब तक टेलीग्राम ग्रुप है आपके पास इंस्टाग्राम तो चलो क्या है, बट टेलीग्राम ग्रुप है. ऑल द MCQ discussions are here, and keep on following us for more MCQs and keep on revising all the subjects. All the very best. Thank you very much beta. Good night.